Hello, my name is Elenwo. I am a second-year medical student at OSU Cherokee Nation, and today I will be presenting on the associations between social determinants of health and frequency of poor mental health days, a cross-sectional analysis of the 2017 BRFSS. In 2020, over 50 million adults in the United States had a diagnosed mental illness. And while the overall burden of illness among mental health disorders is great, studies continue to show unmet mental health needs among United States adults. The frequency of poor mental health days has been shown to be related to individual factors such as socioeconomic status, race, and rural versus urban environments. Additionally, social determinants of health have been found to directly influence factors related to premature death. Therefore, we believe that assessing the disparities in mental health outcomes regionally and among social demographic variables may highlight predictors of mental health outcomes. So our objective was to examine the relationship between the frequency of poor mental health days, which was determined to be 14 days or greater, and social determinants of health, and to also assess which states had the highest rates of frequency of poor mental health days. To do this, we conducted a cross-sectional analysis of the 2017 BRFSS to extract data regarding poor mental health days and to utilize the social determinants of health module. We extracted socio-demographic variables to use as controls and constructed bivariate and multivariate logistic regression models to determine the associations via odd ratios between social determinants of health and frequency of poor mental health days. To visualize the state's differences, we utilized a heat map. And so what we found was that there was a statistically significant association between all the social determinants of health variables and frequency of poor mental health days in both the binary and multivariate regression models as shown in Table 1. The average number of poor mental health days per month was the highest in West Virginia with about 14 days, Oklahoma with about 13 days, and Mississippi also with about 13 days. However, individuals in the states that reported experiencing zero poor mental health days were in Oregon, Utah, and Arkansas. So the significance of these findings are that mental health challenges continue to exist across the U.S. with state-level differences in the average of poor mental health days experienced. And this doesn't account for the urban versus rural differences, which we know continue to exist based on previous studies. The adverse health outcomes associated with poor mental health calls for efforts to improve access to mental health care resources. Some of the solutions that might mitigate the frequency of poor mental health days would be increased utilization of school and workplace-based mental health resources. Additionally, faith-based mental health resources to improve access to mental health care delivery and to reduce the frequency of poor mental health days. So in conclusion, our study found that the frequency of poor mental health days was significantly associated with all domains of social determinants of health. By providing expanded mental health care resources through the use of evidence-based programs, states could improve average number of poor mental health days among United States adults. Additionally, further investigation to identify the specific variables of each social determinant of health domain and their association with the frequency of poor mental health days is warranted in order to improve the efficacy and reach of available mental health resources and to truly identify the level of association between each domain and burden on mental health. Thank you.